Hey guys, welcome to the Hot Pulp podcast. We are joined today by Dr. Masooma Rizvi. She is an international dentist who has done her training in Karachi in Pakistan, and she's now on the UCLA program as an international dentist, becoming a dentist who is able to practice in the USA. So, welcome.
Hi, how you doing?
I'm good, thanks. Very looking forward to this podcast. It's been quite an interesting one that's been on the horizon. Someone who's, done dentistry now in two different places, probably two very different methods. So there's something we can
Very
kind
different.
of have a little look at and see what the differences are. So yeah, I'm really excited about this one. Um,
Yeah, I've been looking forward to it as well.
Obviously, I've kept you away from bed. It's quite early in the US at the moment, but um, we've got you on. Let's what's your kind of thoughts then from your initial stages when you were younger and thinking about what you wanted to do as a job? Why did you stick with dentistry and then after that decide you wanted to move to the US for dentistry as well?
Um, when I was a child, we went for, regular dental cleanings and stuff like that, and I was a very scared kid. And then it came to a point where my dentist decided that I need braces. And then, you know how when you get braces, you have to go to the dentist every 2 weeks, and then it became a routine for me.
Yeah.
And then when I saw my crooked smile turn into this beautiful smile, I'm not saying I have a beautiful smile, just straight teeth. It it just it just
You got more
gave
interest.
rise to that curiosity that
Yeah.
what made that happen. And then I just stuck with it, and then like people who know me, they know that I'm crazy about dentistry.
Mm,
So then I just knew at that point that I have to become a dentist. And then I did my college, applied for dental schools, got into the first choice that there was, and finished dental school. And then life happened, and
yeah.
then I decided to come to the United States. And then the moment I was certain that I'm moving here, I started working on what's the procedure, how the journey is gonna be, what I need to be doing
Yeah.
to make my journey a little bit easier. And in my last year of dental school in Pakistan, it's called a house job, where you're just practicing as a dental practitioner in
Yeah.
each of the dental fields. That was the time when I started working on my NBDEs, which are National Board of Dentistry examinations in the United States. And I started studying for that. And then as soon as I got here, and then I started my journey towards that. We can elaborate it
Yeah.
further during.
So in Pakistan, what's the kind of procedure for getting into dental school? Is it quite easy for you guys over there, or are there a lot of barriers to entry?
Not barriers per se, but there is a straightforward path
Yeah.
for which you have to work really hard because you're from grade ninth till 12th.
Yeah.
All of that matters when you're getting into dental school or medical school.
So that's from like
You
14,
have
14 years old or
um,
sort of.
not 14, not 15,
Okay, yeah, around
15,
around the
16,
mid-teens.
17, 18. Yeah,
Yeah,
when you're like in your peak teenage, you have to be studying a lot, and then all of those grades matter. And then there's another examination. It's called MCAT. It's the same as in United States, but in Pakistan we don't have DATs. We
right.
just have MCATs. So I took MCATs, for which I studied really hard. So that mattered, and then it depends on the merit. There are like thousands of people applying, and then you have to make your spot. I got
Yeah.
into a medical school, so I had a choice of picking dental school or a medical school as my merit was a little bit higher.
So you kind of had that latest kind
Yeah,
of
yeah.
decision to
So
make.
I chose dental school on purpose.
Right, okay. Yeah, so in the UK, obviously, it's very similar. We have to do GCSEs and then A
Uh
levels.
huh. Yeah.
UK CAT is what we call it, so we've got something probably similar,
Hmm.
but we have to apply for a specific school on a specific program. You don't get the kind of overall sort of things. We're quite similar. Um,
Yeah.
yeah, so obviously you went into undergraduate, done the dentistry. Was that a very traditional course? Was it lecture based first, and then going on towards clinical years more and
So
more?
the main difference that I've been finding in my training back in Pakistan, um, okay, we're connected back. So the main difference that I've been finding in my dental training here in the United States and in Pakistan, Pakistan was more based on theory,
Right.
like reading the books, taking the exams. It was not focused on practice as it is over here. They teach you how to do it, and
Yeah.
then they teach you what's the theory behind it. So it makes sense a little bit better when you're actually doing something.
Yeah, you're doing it side by
So
side. Yeah.
yeah, so that was the difference. In Pakistan, first 2 years were basic theory, no practicals whatsoever.
Yeah.
And then in third year they put you in clinics, and then things start making sense. So they have their own ways. Here, there are other ways.
What do you feel about the maybe quality of teaching? Is it just two completely different styles, but can you kind of quantify whether they're both at the same level, or do you know whether you found that one's helped you more than the other? Because obviously you've got different learning styles in different people.
So now when I think about it, like here in US, it's making more sense to me.
Yeah,
And now, like, I'm not sure it's making more sense because I'm doing it for the second time. You know what I mean? Like when you're doing
yeah,
things the first time, it's a little, you're not very sure about it. Both of the schools, they taught us really well.
mm,
Here, the same thing again. The visual aids, the learning material, it's readily available here. So you can do your homework on your own. In Pakistan, we had to chase professors. Can you give us this? Can you give us that? Things were not readily available. It's just the resources. You know, we had limited resources in Pakistan
yeah.
rather than here in the US.
Um, do you find are you treating patients in the US currently as part
Yes,
of the
we
course?
just
Yeah.
started clinics, yeah, last month.
Do you find that you're getting more clinical experience in here or in Pakistan? Because obviously in Pakistan there's a disparity in the relative wealth of people. So
I
there's probably a lot of
treated,
people ready to have
yeah,
treatment.
I treated a lot of patients in Pakistan,
Hmm.
and right now in the US, it's too soon to say because it's only been 1 month.
Oh, right, you're very close into it.
Yeah,
Right.
so I started my program in May, and we started clinics in July. So it's just been a month of clinic,
Yeah,
and it's too soon to say in the US right now.
fair enough.
Yeah. Mhm.
Obviously you've got insurance-based systems, so there will be people who are happy and
Yeah,
willing to turn up.
there is
Yeah,
big patient pool that we've got,
yeah,
and now when the school starts again, we start seeing them again. So just that.
yeah. Brilliant. What do you think it's different to what you kind of anticipated being in dental school treating patients to what you thought before you even started, if you can remember that far back?
I don't think it's that different. I
Mm.
knew, like, I had friends who were in the program.
Yeah,
I was working with a dentist who was graduated from UCLA. So they had already prepared me what's coming up,
yeah,
what to expect, what not to expect, how you should be, doing certain things to get the most out of the program.
yeah.
So it's pretty much what I expected it to be, and it's going really well so
Brilliant.
far, so good.
Yeah. Um, were there any alternatives that you had in mind before you started?
Oh, yeah.
Because I had hundreds. I
So,
was very
yeah, so
undecided.
let me tell you a little bit about how this application process goes. It's called CAPID.
Yeah,
It's a year-long process when you apply to schools. Then you have to wait like months to until the completion of the application date. Then there's an interview call. Then you go for an interview. Then they give you the results out. So it takes about 12 months, 18 months for you from applying to getting into the dental school.
yeah.
So last year when I applied to almost 10 schools, and halfway through my journey, I hadn't gotten any interviews. So I was a little,
Off-putting.
hopeless,
Yeah,
kind of, yeah. So I had done my boards and everything, so I was kind of rerouting towards a master's program in oral biology
Yeah.
because I was involved in research with microbiome and everything like that, and I really, really liked it. So,
Yeah.
like, okay, fine. If not DDS, then I'll go do research, like, make my career out of research. So, I was already set. I was waiting for September 15th for the application to open for the master's program.
Yeah.
But then, before September 15th, I got my interview call from University of Pacific, and then the things got back on track again.
Yeah. So then you start getting them rolling in. They're probably just
Yeah.
a bit slow, and
Yeah.
so yeah.
So yeah, I was kind of like on the edge of, okay, fine, I'm not gonna do DBS anymore.
What research had you done previously then?
I have been involved in research with periodontology. So
Okay.
periodontal microbiome is the main focus of stuff. So I have worked with BioLase, which is the lasers.
Yep.
So it was a research study to compare SRPs plus lasers and SRPs alone on the pocket reduction.
Right. Okay.
That, and then there was an ortho study comparing the oral microbiome in patients with braces and clear aligners.
So what would your take home from those two studies be for a general dentist? So we don't like reading the methods, and we don't like diving through the results. We just want to read the abstract and the conclusion.
So for the laser study, laser did not make that big of a difference that I would go suggest to a general dentist, no, you have to buy a BioLace machine.
Right.
No. If SRP is done well, they're the best way to go for pocket reduction.
Yeah.
And for the ortho study, of course, clear aligners are better in plaque control because you can take the trays out, clean it, put them back in, compared to braces. But still, it depends on the cases. There are certain cases where you cannot give clear aligners whatsoever. Like you cannot.
Yeah. There's
So
things they can't.
for
They
them,
can't
you
do.
have to teach them oral hygiene. Yeah.
So a lot of it's just kind of common sense, and it sounds like
Of course,
things that you probably would have known, but you need some sort of study to back it up. Things that
to support it.
Yeah, because a lot of the time we do things, and with not a lot of money behind dental research, we kind of go, it seems this works.
Mm-hmm.
So we're going to continue to do it. So you've ticked the box of saying, this is the right thing to do, or this is the way forward for it. Brilliant. Mm-hmm. Let me go back onto my notes. So running back to DIDC, so Dow International College in Pakistan, how did you find that course? Like, what were the real strong points in that course that you found that really helped you since you've come to America, that you don't have to kind of worry too much about certain things?
The fear of treating patients. I don't have that fear anymore.
Yeah.
That, how to talk to patients, how to tell them what to do and what not to do. Over here, fortunately, people have more dental awareness rather than what there was back in Pakistan.
Yeah.
But still, that initial fear of talking to the patients, treating the patients, it's not there anymore. So it's kind of it's a good plus on my end that I can directly jump into treating the patients rather than overcoming that anxiety of treating them.
So your hand's not shaking as you come in with a burr?
Not anymore.
Yeah, because I get that question a few times since I started doing all this thing. There's people asking me, "Oh, it's my first patient next week. What shall I do?" Like, this what I say to them, just don't worry about it. There's people who's going to be looking over your shoulder in dental school. If you're not sure of anything, just ask them and see how it goes from there, and just don't dive in and do something silly. Is that kind of what you would say, or have you got anything to add?
Funny enough, I can give my own example. I still remember my first patient. It was oral surgery, and it was my first ever patient.
Okay.
And I block the inferior alveolar, and the patient goes in syncope.
Oh.
Oh my God, I cannot forget that. I cannot. But still, that's how you learn. That's how I learned how to treat a medical emergency in a dental setting. That was my supervising house officer. Then there were teachers. So they made sure that everything's fine. You did
Yeah.
not do anything. The patient's going to be okay. So
Had you
it's
just
fine.
had you
It's
just not eaten?
natural,
Yeah.
Yeah. There is going to be that anxiety when you're treating your first patient, yes. Whatever I say, it's not going to change it.
So to clarify,
So,
it was the patient that collapsed, not you.
oh, yeah. Yes.
Yeah. I always remember we did cannulation on each other, and there
Oh,
were
wow.
because people do sedation, so they cannulated
Yeah.
everyone. We were doing each
Hmm.
other, and then see all the boys collapsing and fainting once it goes in. It's just like, oh, you can't give it all the big ones anymore. Everyone's seen you
Yeah.
faint with a little bit of blood, so it's perfectly
Yeah.
normal to all
We
you guys out there.
we have that coming up. It's like
Mm.
first week of our next quarter. We're going to be injecting each other. So let's see how that goes.
Yeah. Have you not had an
Yeah.
injection previously?
Of course.
Yeah.
But still,
By someone who knew
when
what they were
when
doing.
your friend is blocking your nerve,
Yeah.
it's a little nerve
What are
wracking.
your best memories from your first degree then?
Oh, my friends. I
Yeah.
miss my friends a lot.
Has anyone made the
They
move across
were.
yet?
I'm sorry, what?
Has anyone else made the move across to the States, planning to
Yeah,
join you?
one of my friends from dental school is here. She's taking her boards right now.
Yeah. So you'll be
So
together.
yeah.
That'll be all good.
Mm-hmm.
Uh,
Hopefully.
any funny stories from your first degree as well? Patient stories. Everyone's got something that a patient did or a patient said that you just go, wow, that was just hilarious, and you kind of have to tell everyone.
I think my first interaction with the patient was hilarious for me when
Yeah.
my patient just fainted in front of me.
Um, what did you find difficult with that first degree as well? Obviously, everyone goes through the stage of going, oh, why did I choose dentistry? It's too difficult. Let me just go and do something else. Did you have that, or did you have like a period where you
Mm,
were like just a little bit thinking about what have I done?
no. So I think I did not get that phase in my dental career
Mm,
because a lot of people, like a lot of my friends who passed out dental school and they were having a hard time deciding what to do next or not finding a job that they were looking for.
yeah,
That's the period when they're like, oh, why did we go to dental school? We should have done this, we should have done that. So with me, I did not feel any of that ever because
that's
when
good.
I finished my dental school over there and the same month I flew out here.
Yeah,
So there wasn't that stagnant period in my dental career. I was constantly doing something. And in my third year of dental school back in Pakistan, I had decided what I have to do after dental school. Like I
right.
had my residencies lined up. I knew when I have to apply. So maybe that's why it never happened.
Because you had like a
None
very
of the
good plan.
things that I planned, yeah,
Yeah,
none of the things that I planned worked out, but still, there
yeah,
was never a time where I was like doubting myself for
right.
doing dentistry.
That's
Yeah.
quite good then. Obviously, you've picked something quite early on in your life where you're in a happy about it. Whereas maybe some people weren't 100% sure. Maybe that decision come
Yeah.
a bit early for them, and then they get around
Maybe
to it in the end.
that's the thing about me that if I set my mind to something, I'm gonna do it. Like I'm
Yeah.
not gonna stop until I do it. So maybe that's why, like, yeah, it never happened.
And finally, on your first degree, what are the biggest tips that you would give someone who's going through
Oh.
the degree back in Karachi? Kind of the big tips for those guys.
Study every day. We used to, yeah, I get it that you get tired after school, I get it, but
Hmm.
you have to do it, you know? Because the thing is that you cannot understand the concepts of dentistry on one time read. Maybe you'll clear your exams on one time read, I get it. But
Yeah.
you're treating a human life, so you have to respect that. And you cannot get that clear understanding on just one read because the books that we're using, they're big books, they have so much knowledge in it, like there's so much information that you have to grasp on.
Yeah.
And I don't think it's humanly possible for anyone to get it on first time read. So, like, if I can do something better, if I go back,
That was
that's
my
one
next
thing that I
question.
would change. I would study every single day and study it until I get it.
Yeah.
There were a lot of concepts that got cleared when I was doing my NBDE part 1 or part 2. And it shouldn't have been like that.
Yeah.
Like, our focus was just to clear the exams so we can move forward.
Yeah.
When it comes to treating patients, it hits you that, oh, I wish I would have done that. Oh, let me go read it back again. You know what I mean? So just respect that human life that you're treating. It's not like you're not repairing a phone or something.
I think
You're treating with a human life.
that's definitely something that I myself experienced.
Mm-hmm.
We got through the exam, and then I find myself having to text or message one of my old tutors back in dental school. I remember you vaguely saying something about this. What did you mean? How do you do this? And he goes, we did try to tell you this. It was relevant for your future, but you guys just wanted to pass the competencies, pass the exams. So yeah, that's definitely really, really good advice. And you've also answered my next question, which is what would you do differently? So we're 2 for 2
I would
there.
study a lot more.
Yeah. Obviously, you're still in dental school, so now what's your kind of plan for the future after you finished?
After I have finished, as of right now, I really want to go do a residency in periodontology. And I am focused on that. I'm working towards it. But, one thing that all of this journey has taught me is nothing is certain.
No.
So just focus on what it is right now. So I'm trying to focus on dental school right now, one step at a time. What's going on right now, instead of worrying about what future has planned for me.
Yeah.
So whatever's planned for me, it's gonna happen. I should just focus on what it is right now. But I would love to go to a residency in perio.
Are there any things that you're doing currently which are kind of building your CV for that?
I'm involved in implant study club at school, in perio study club at school.
Yeah.
Trying to take courses and stuff like that just to, give me a better sense of perio. Before I started school, I had done a preceptorship program in periodontology at UCLA itself. So those kind like that preceptorship was the main gateway for me to, introduction of periodontology. So that's where I learned that I loved perio and I want to do it in the future.
What are your thoughts on the new classification system?
Oh, wow. So it just came out when we started the program.
Yeah.
And all of the teachers were frustrated. Oh, they came out with another classification. So for us, it was easier because we were not taught the older one.
Yeah.
So we just learned the new one.
So you start from there. A lot of people say that it seems like it's made for the academics and doesn't have so much
most
relevance.
Most of the practitioners say that,
It doesn't have so much relevance to someone who's trying to treat it because it's the same disease, and the way you treat it hasn't changed. It's just what you're calling it, and there's still flaws.
So when I was learning the classification during the course, I was like, okay, if the patient has this and this, what's gonna be the grade?
Yeah.
If this is so I go to my professor and she's like, yeah, it's more like of a theoretical thing. It doesn't happen in real life, and I don't know what. Like, all of the professors were like, we don't know why they came out with this.
Yeah, it feels like they're just trying to go in line with things like cancer, grading and staging things.
Yeah.
So to patients, it makes maybe more sense potentially, or maybe scares them more. I think it probably scares them more than making sense more. Yeah. So obviously, it's not really changed how we treat things. We're still doing deep scales and
we're doing the same things. Yeah.
What are your tips then if you're getting in? If you're a new student coming from overseas, wanting to get onto a program, advanced standing program, what are the step-by-step things that you would be looking at in your kind of flowchart of do this first, do this next, and then apply?
First, be very proactive. Do not sit at home and just study for your boards. Go out there, get the experience, talk to people a lot more than you would. That was one of the things that I had to step out from my comfort zone.
Yeah.
I had to network a lot. And that's what helps you. People guide you, people help you, they tell you, go do this, go do that, go talk to the professors. While you're doing all of that, start on your NBDE preparation. One thing that I would change in my journey was that I would have prepared for my NBDE part one back at home. So when I
Right.
came here, I could have just taken my boards right there and then. So I don't have to spend a lot more time in just studying for part one.
When you got to America. Yeah.
Yeah. So
Okay.
I would change this in my journey that I would have studied for it before I came to US.
Yeah. Okay, there we go. Yeah, I was asking you just before we cut off, how
Hmm.
you found the move on more of a personal level. Have you found the move from Pakistan to the US kind of smooth sailing? What have been the challenges there?
It wasn't smooth sailing at all. It's just the work ethic that you had in Pakistan. It's not gonna work in the United States. You have to be proactive. You have to be one step ahead of your game if
Yeah,
you want to succeed. So I would say prepare for your NBDs, like at least for part one before you get here. So you
yeah,
can just take part one maybe in first 2 weeks of your life in the United States. So you don't have to spend a lot more time just in a library or somewhere just sitting and studying.
yeah,
I would rather prefer going out, talking to other dentists, talking to professors, network yourself out, talk to people because they help, they guide you in the right way. And
yeah,
you need guidance over here.
yeah,
You cannot just do it on your own. You have to talk to people, go out there, tell them about yourself, tell them, show them that you're desperate to do dentistry. You
right.
want to learn here in the United States since you're making a life in a different country. You would want to have those skills, that improvement in your skill set to practice in a country where you plan to have your life in the future.
Yeah. Have you found kind of people welcoming when you've got across there? Has it been easy
Yes.
that side of things? 'Cause you hear different things. Obviously, there is
Yeah.
the whole kind of right wing side of things, and maybe in the media a little bit, but the people when I've
So
been have been quite nice. So there's two sides of that coin.
you'll find all sorts of people everywhere.
Yeah,
You just have, like, if you're not going to talk to anyone, you're not going to find good or bad, you know? Or if you go to a person and he or she says no to you, you cannot just be like, no, everyone's like that. You cannot generalize it like that.
yeah,
So myself, when I came here, I was in the middle of my part one, part two. I was trying to get a job as a dental assistant, and I was interviewing for jobs, and there were a lot of places they just they
they
just
weren't going
said
for it.
they didn't even like me in the interview.
Hmm.
It broke my heart, yes. It broke my confidence, yes. But what if I had just taken their nose and just sat at home that, oh, I'm not good enough? You know,
Yeah,
you have to have that faith in yourself. You have to have that support system around you that builds your confidence back up.
yeah,
Then, after like several rejections, you find that right place. You find the right place who's going to give you a chance, who's going to give you the right learning that you need.
yeah,
I still thank the doctor that I worked for over a year. He, like, until the last time I talked to him was Friday, which was 2 days ago, and he's still really welcoming. He's very much respecting of the fact that I have done this before
yeah.
and I can do it again. So you
Brilliant. Yeah.
need to find that right person.
Um. So yeah, that's one thing, and then more socially, have you found it easy to find yourself in kind of like a good group of people who you can go out
Yeah,
and relax with?
of
Um.
course. So one of the steps in this advanced standing dentistry is the preparation for your bench exam.
Yeah. Have I lost you again?
Are we back on?
I can hear you.
Yeah.
Yeah.
All right. So as I was saying, one of the steps in this advanced standing program is that you have to prepare for a bench exam, which is one of the requirements of getting into a dental school.
Yeah.
So at when I was preparing for my bench exam, I found two of my friends who I can call my best friends for life. All of us, we got into dental schools, all different dental schools, but still,
Yeah.
we got in the same year. We're still friends now, and best friends for life again. And then in my dental school, I have a very, very good group of friends who I work with every day.
Yeah.
And then, yeah, so you get combined with traditional students as well who are very welcoming to you. Most of them, like, I have made friendships with
Yeah.
a lot of them now,
Brilliant.
just in a period of 2 months.
So is that, would
Very
you be
good
in with the
people.
D3s, is that right? Or is it the D4?
Yes, D3s.
Threes.
No, D3s. Yeah.
Yeah. Okay, brilliant. I think I knew some of those guys
Yeah.
from everything.
Yeah.
What made you kind of going back to the actual move? What made you want to move to America as opposed to staying at home? Are you the first person to have moved from your family, or do you have family links in the
No,
US
yeah.
as well?
My sister moved out to Canada. She's a dental hygienist over there.
Yeah.
And I really wanted to do dentistry.
Yeah.
So the place closest to Canada was US.
The US. Yeah.
Also, I found my husband here. So
That
now I
makes
have
things
my life
easier.
here.
Yeah, that makes things
Yeah.
easier. Yeah, that's always an interesting question because um, it's a big move to move, away from your parents and that sort of thing. But if you have family across there already, then that
Hmm.
makes things easier.
Yeah.
Also
I have all of my family here.
yeah,
So that makes, that's the support that I have. All those times where I started doubting myself, these were the people who I came back to, and they helped me get back on track. That
yeah,
you can do it. You have done it before. It's not like you're doing it for the first time.
yeah.
So,
Yeah, that's always an interesting one because obviously I have
mhm,
family everywhere.
mhm,
I think Pasadena, my uncle's there, and then we had family
mhm,
in Canada, a lot in Michigan as well,
mhm,
Detroit area. So there's always like
yeah,
connections. I've found that
yeah,
there's crazy connections between kind of
yeah.
dentists. You end up knowing everyone, so it's actually quite good that way as well.
That's why you
Yeah,
have to network yourself. Everyone knows everyone. All the
yeah.
dentists across US and Canada, they know each other somehow. There's this weird connection between all of them.
Kind of on that, have you been to any conferences in the US?
Yeah.
I'm currently looking at the Chicago conference in the midwinter 2020, February. I can't work out how to get
Mhm.
into it. I've emailed them. I'm trying to work it out, but those are a great way. So
Yeah.
definitely, I'm going to be there. So any guys who are watching this,
Yeah.
drop me a line. I'll be
We
around.
Yeah, I have been really into CDA, which is California Dental Association. Of course, I live in California, so
Yeah,
I want to network out here. I've been going to the conferences, I've been volunteering at this event called CDA Cares, where a lot of the dentists from the US, they volunteer to treat patients from low socioeconomic area free of charge.
oh
So
great.
pretty awesome event. Yeah, one is coming up on September 28th as well. And now I'm going as a dental student.
Yeah,
That and then there are local components like I live in San Fernando Valley, which is part of California, Los Angeles. So I am involved in the Dental Society of San Fernando Valley as well. So they give you CE courses, they give you workshops, you go out there, you talk to people
yeah.
and all that kind of stuff. Yeah.
Um, Moving away from dentistry now, I think we've covered quite a lot there in, what you're up to and your plans for the future and all that sort of thing, how to get into dental school if you're doing either back in Pakistan as an undergraduate and also as international standing dentist to come and work in the US. What do you kind of do in your free time? What are your goals outside of dentistry?
Goals outside of dentistry is that I want to have a bakery right next to my dental office in the near future.
So
I am a
you
baker.
create the
I
patients
love.
and then send them across. Is that the idea?
Yeah, that's like my trick. Go to the bakery. It's gonna rot your teeth. Come back to me then.
Yeah. For anyone who's
Yeah.
gonna sue, this was a joke. Just don't get too much
Yeah,
of
yeah. It
about it.
was joke, guys.
Yeah.
Yeah.
Um, yeah, and other things that you do in your free time. Have you got any like sports or things that you're into?
Not sports, but I like to bake and I like to do artsy stuff a lot.
Okay.
I do crafts. I decorate my house with all the crafts. I like throwing parties if
Yeah.
anyone wants me to decorate their party or something. I'm a big party planner.
Okay. That
Yeah,
sounds fun.
I love arts.
So maybe like you could run some of the CDC meetings or something. You
Yeah,
know,
maybe.
get everything going. Beautiful.
Yeah,
Um,
a DIY workshop by Masooma Rizvi coming soon.
moving towards like this is a question that's really random. I thought it was great to add in. What's your favorite conspiracy theory? It can be something completely random.
Um,
I think I've
I don't
stumped you here.
know.
Completely stumped you here. Uh,
Uh, I don't believe in conspiracy theory. I follow them on Instagram though.
yeah.
They're like, bro,
What's the
oh,
craziest?
the
What's the
conspiracy
craziest one?
theory of Instagram's listening to you. Like it happens sometimes,
I
but
definitely have
I
that
don't
one.
know.
I'll
Yeah,
spoken about I don't know a car that's gone past, and then I'll get an advert for one. I'm like,
yeah.
wow, that's I don't even think that's a conspiracy. I think that's just true.
Sometimes the thing that you just think about pops up on your Instagram. So I don't know how that happens.
What's that happened to you with? Has it been like,
I don't remember exactly, but there was something that I was thinking about, and one of the story ads that come.
yeah,
Like, ooh. I don't know if it's true or not, but it happens definitely.
sidestepping
Maybe
on?
there were some pants or a dress that I was thinking of getting. It was something like that, yeah.
Um, kind of moving back to Instagram. How have you found that's helped you with your networking once you moved to the US? And what kind of things, if people are wanting to follow you, are you posting on there? Why would someone, jump on and hit
My
the follow button?
my dental Instagram,
Yeah,
it's not more for me, it's for other people.
right.
I made it when I got into dental school, and I thought that, okay, yeah, these were the things that helped me through my journey, so I want to help other people because I didn't have a lot of help as, from the past candidates.
Yeah,
So I wanted to help people out because there are so many uncertainties that you face when you're going through that journey, and I wanted to answer all the questions. I still try to answer all of them. Sometimes when school gets crazy, I get a lot of messages backed up to
yeah.
answer, but I try to reply to all the emails, review all the personal statements. Like I think I reviewed 10, 15 personal statements in a matter of 2 months when the CAPID cycle started in March.
Right. Wow.
So yeah, I
Yeah.
was happy. I was happy. It's not more for me. It's more
Just
for other
for
people,
other
and I'm.
people. Yeah.
It gives me the sense that I can help somebody. You
Yeah.
know. Yeah.
Um. Obviously, I've seen your stories. You get loads and loads of questions. What are the really
Oh.
common ones that crop up? Just to kind of
Hmm.
address those, and
Yeah.
what's the most common sort of things people are asking you?
What should I do? I have done my DDS, I've done my BDS in India or in Pakistan. Now tell me what should I do?
That's an impossible
So,
question. Yeah.
so I keep saving all the question answers in that captioned highlight that I have on my Instagram.
Yeah.
So the first response that I give out to people is go through my highlight. If you don't find your question in there, ask me then.
Yeah.
Ask me specific questions like what do you have in mind? Guide me for the life in United States is a
It's an open question.
very broad question. So there are a lot of things involved. There are visa statuses involved. There are what do you want to do in the future? Do you want to go in academia or you want to be a clinician? You want to do research? There are so many things.
Yeah.
So many things. Yeah.
Um. I think that's kind of most of the things that I wanted to ask you and see what you're kind of interested in.
Hmm.
Um, are there any things that you kind of want to get out there and that will really help people who are out there?
Just that stay focused
Yeah.
and do not start with your journey to DDS if you are not 100% sure that you want to be a dentist. It's a very hard, grueling, it takes a lot out of you
Yeah.
just to be on that track. Because it's not very easy. It takes a lot of hard work. But for those who are 100% that they want to do dentistry, I just want to make sure that it's going to be worth it. When you get into this program, it's all worth it.
Yeah. Yeah. I think that's definitely something that can be said. You know, it's not for everybody. Just because you might be really
Yeah.
academic, it might
Yeah.
not be the right thing, because you have to
Yeah.
sit there and you have to physically treat someone a lot of the time, unless you're going to go down academics, and do studies and stuff like that. It is a
You
physical
won't be
job.
able to take that amount of stress if
Mm,
you are not 100% about it. Like if I wasn't this crazy about doing dentistry, I don't think I would have done it.
yeah.
And all the like the rest of the 19 people who are with me in this program, they're all like super out there, you know,
Yeah.
on the edge of just going like tipping off the scale of crazy for dentistry.
I think it's almost a job requirement. Yeah.